Welcome to ASHB's quarterly Smart Home Council webinar meeting. My name is Marta Kliptowska, and I'm the Programs and Communications Manager here at ASHB. I will be emceeing the slides today. Please note that today's webinar meeting is being recorded and will be circulated for those who registered along with the presentation slides. During and or after the keynote today, you are welcome to raise your hand and unmute yourself to ask a question, or at any point during or after the presentation. You can also use the Q&A or comment boxes to submit questions or share any feedback. Quick look at today's agenda. We'll start with a call to order, welcome, introductions, a little bit about who we are and what the Smart Home Council is. Just go over a couple administrative items. Greg Walker, ASHB CEO, will go over our recent research update on our Smart Home project, landmark research project. And then we will begin with our keynote, Connected Home, Connected Care, Smart Technologies for Aging in Place. Alan R. Bugos from LifePod Solutions. Alan, I hope I pronounced your last name correctly.
Yes, that's correct. Bugos.
Okay, excellent.
Good job.
And then we'll just go over a couple of ASHB's programs, our podcast, white papers, journal. If there's any new business that anyone on the call would like to share, and then go over just a couple announcements, some events that will be taking place, and then of course we will adjourn. I'll pass it over to Ken Wax to share a little bit about who we are.
Thank you very much, Marta. Welcome all to this quarterly meeting of the ASHB Smart Home Council. This council was created under the former corporate name of ASHB, which was the Continental Automated Buildings Association, or CABA, created in 2004, the Connected Home Council. And the Smart Home Council that we're at now continues the process of initiating and reviewing projects related to the connected home and multiple dwelling unit or apartment buildings, technologies and application. Our council also examines industry opportunities that can accelerate the adoption of new technologies, consumer electronics and broadband services within the growing connected home market. The Smart Home Council webinars and selected research topics explore industry shaping trends and forces and the use of technology to make connected homes more flexible, adaptable, and human-centric. Our first order of business is administrative. It's to approve the minutes of our previous meeting. The minutes from our meeting of August 14th early this year have been circulated. They're available on the Smart Home Council website. And I'd like to know if anyone has any objections to the approval of the previous minutes. I'll just pause a moment, and anyone who has any concerns about the accuracy of the minutes, please speak up. Hearing no objections, we'll consider the minutes approved. Thank you. And now we turn to Greg to tell us about ASHB research.
Actually, Ken, before we do that, just wanted to make a quick note, and I apologize, Ken, because I forgot to mention this to you. We are looking for vice chairs for the Smart Home Council. So if anyone on the call today is interested, there's not too much to this. There's really just 4 meetings a year, and a lot of what we do during this meeting is prepared well in advance by us here at ASHB. So really, it's just more of a leadership role, just to help us guide through the meeting, and if there's any items that you would like to share with the group, and really approval of keynotes and whatnot. So again, if anyone is interested, you can email us at admin@ashb.com, or you can also send me a message, and then we can have a quick chat about what really is involved in becoming a vice chair. Apologies for that, Ken, and then we can now pass it off to Greg Walker.
Thank you, Marta. And now we'll turn to Greg.
Thanks, Marta. Thanks, Ken. So I won't take too much time, but this is one of the initiatives that the Smart Home Council does every year, and we run it through the Smart Home Council. We do collaborative research projects, so essentially crowdfunding of research through our ASHB members and members of our Smart Home Council. And so you'll see some of the funders on the screen here, like Daikin, Lutron, Residio, Train, and the NRC. They each chipped in funds and to create about a $50,000 research project on smart home trends and technology adoption. So this is a continuation, like I guess third year now, a continuation of a project, and we're looking over year trends and technology adoption curves, similar to the the Gardner hype curve, but more tailored around smart home devices. It was sort of brought forward by Residio and some other funders, and we contract this work out to Harbor Research, who won the bid to complete this project, and it looks at 500 homes in U.S. and Canada, and does in-depth interviews as well. And it looks at a trends analysis report. So we do a deeper dive with some infographics and whatnot in the smart home roadmap for sustainable technologies, redefining AI native in smart homes and occupants, and occupant-centric environmental comfort and wellness, and some technology-assisted living and aging in place areas of the research. So if you're interested and want to get this full research project, it's available for sale in February 2026. But feel free to reach out now, and we'll also be doing a similar project in early 2026 if you or your company wants to get involved in one of these collaborative research projects. So it makes it a little bit more cost effective to do these projects if you're sharing the funds and the cost around a group of other companies in the space, and also it creates a little more holistic research project at the end of the day. It's a wide variety of topics around smart home trends and technology adoption. So if you're interested, feel free to reach out to myself or Marta, who's done a lot of work on this project throughout the year. Just shoot your information off in the chat, and we can talk about the 2026 project or this particular one if your company wasn't involved. So I don't want to take up too much time, but does anyone have any particular questions about the research? So I guess with that, I'll pass it off to you, Ken, or maybe Joshua, to go over this the keynote speaker presentation.
Yes, I will take it over. Alan Bugos, I don't want to pronounce your name incorrectly. Is it Bugos?
Correct.
Is correct? Okay. So let's start this. The keynote, connected homes, connected care, smart technologies for aging in place. As more people choose to age in place, connected home technologies are becoming essential to health and wellness. Today's keynote explores how broadband, IoT, and smart devices are transforming care, from remote monitoring to emergency response to reducing isolation and improving safety. Alan Bugos, who will share how these innovations are shaping healthcare, empowering caregivers, and helping us from reactive to a proactive care. Alan R. Bugos is the Chief Technology Officer and COO for LifePod Solutions, where he leads the innovation in connecting care and smart home technology that supports healthcare, wellness. With over 30 years experience spanning from medical devices, telecommunications, IoT, and software development, Alan has held senior technology leadership roles at Health Recovery Solutions, MedMinder Systems, Philip Healthcare, Vonage, and others. He is also a recipient of GTE prestigious Warner Award for technical achievement for his pioneer work in DSL data networks. Alan has published more than 45 technical papers and holds several patents, and is an active member of IEEE, ETA, Kappa, Nu. With all this said, let's welcome Alan. Alan, take over, please.
All right. Thank you so much. That was a very kind introduction. Let's see, I'm going to share my screen if that's okay.
Of course.
All right. And let me know when you can see my screen.
Yes. Did you want to maybe do a full screen, Alan?
Yes, I will.
Perfect. We can see
Okay,
that.
perfect.
Excellent. We
Okay.
can see it now.
All right, wonderful. So my name is Alan Bugos, and it's my pleasure to spend a little bit of time here with you all, talking about a topic that's dear to my heart, the connected home and leveraging it for connected care. I am actually 65 years old, so I feel that I might be using a lot of these technologies myself. And I do have two parents who are both in their 90s, who have been very helpful to me and my companies uh, develop some of this aging in place technology. So my parents live in Tennessee. They're 1,000 miles away. I'm in the Boston area. And some of the technologies that my brothers and sisters, are leveraging allow us to check in on them, make sure that they're doing well, look at trends in their vital signs, make sure they're taking their medication, looking at, senior safety. Falls are now a big concern of us siblings. And all of what I'm about to tell you is exactly why we're doing this. So I'm also going to go through my slides. I actually have about 40 slides, so I may go through these fairly quickly. But I mentioned that I will share the presentation afterwards. And if there's something that you miss, then you'll be able to, review the slides at your leisure. I think I can see everybody. So, if anyone has a question or a comment, feel free to interrupt. That's perfectly fine. I'd like this to be interactive, and any questions or any comments, any thoughts, feel free to dive in. So, some of the things we're going to explore quickly as the US population ages, where do we see the role of connected home and health technologies evolving, specifically for aging in place? One of the reasons that, well, partially one of the reasons my parents are not in assisted living, senior living, is because they have a smart home with connected health tech devices. They're able to manage on their own with us caregivers afar. We are also very well aware that many of the seniors that we cater to actually want to live continuously in their home. Nobody really is dying to go to assisted living, a skilled nursing facility, or independent living. So having these technologies and these capabilities for the care team, the clinicians or the caregivers, is very important. We'll look at some of the remote monitoring technologies. I know a lot of you are now tuning into what's happening with artificial intelligence, generative AI agents, and what's happening there with respect to the data. So just because we have devices, that doesn't necessarily mean that that's all we need. We need to understand how they promote the data. These new technologies will help improve patients' adherence to their care plans, medication, for example. And then, we'll look at some of the kind of cool things that are happening out there with some newer technologies that you may or may not have heard about. So I'll spend a few minutes talking about the drivers in healthcare transformation, embracing the Internet of Things, having internet connectivity, whether it's wired, fiber, or cellular, is driving a lot of the use cases and capabilities that we've deployed in the home. What does a connected home for connected care look like? What are some of the health technologies? And then we'll look at some of the use cases. And if we have time, we'll go through some Q&A. So healthcare in industry, an industry in transformation. So, basically where healthcare is moving. And by the way, my wife and my daughter are both nurse practitioners. So I do have a nice sounding board to, kind of ask questions and, get their thoughts and feedback. Not to mention the companies that I've worked for. We also, are very attuned to our patients and seniors. we always want the voice of the customer. But just a couple things that are happening, population health management, consumerization, meaning like we have wearables now, smartwatches, devices, low cost that, kind of help us with our health monitoring. There are new business models, much of which is moving from, sick care to what we call value-based care or population health management. And, these are where the clinicians, the family doctors, the accountable care organizations and healthcare organizations are going, right? So connected care, industry consolidation, new clinical technology, and then obviously digitization. If many of you, do have a primary care physician, more than likely you go to their portal where you get all of your digital information versus the paper. Enabling integrated continuous healthcare via the Internet of Things and analytics of things. And these are driving these solutions. So much of what we're seeing, and you're probably aware of a lot of these terminologies, you're seeing cloud-based systems, sensors, low-cost sensors, connected devices, machine learning, artificial intelligence, analytics, all of this data is going into what we call microservice architectures and platforms. And this data is being leveraged for insights, prediction, analytics, and healthy outcomes. As we develop these technologies in the home, we also have to be very aware of data privacy and cybersecurity. So just looking across the board here, health tracking, visualization, and this can also be done with data collected at home that can be done in all the back-end systems. We have home remote patient monitoring, genomics, adaptive interfaces. These are all some of the use cases that the hospital systems would leverage from any data collected anywhere, more specifically in the connected home. Yes, a couple quick statistics. 1 out of 3 people will be diagnosed with cancer in their lifetime. 500 plus million people have respiratory diseases, COPD. 400 million people worldwide have diabetes, and 1 billion adults have hypertension. So, with all of these chronic diseases that are surfacing for the aging population, there's obviously a need to monitor, prevent, and also essentially cure. Another big challenge, which is why the smart home, connected home is very important. As I mentioned, I have 2 brothers and 2 sisters. The 5 of us are caring for my parents. None of us live very close to my parents. We're all separated by several thousand miles or a couple thousand miles. And having these technologies allows us to kind of keep tabs on my parents. And it's not just us, but this is a challenge for all caregivers, specifically family caregivers. And as you probably have experienced the same situation, you may be caring for a loved one who does not live in your hometown. So the connectedness of remote care is obviously on the rise and very helpful for caregivers and remote clinicians. Yes, proactive approach to connected health. Well, 73% of healthcare professionals said connected tech is important to improving the prevention of medical issues. And we're definitely seeing that. I think over the last couple of years, and more specifically, when COVID occurred in about 5 years ago, healthcare professionals and healthcare technologists, embrace the whole concept of connected care. So these numbers are moving, trending upward, that this is indeed helpful, that with connected technologies and the ability for clinicians to care for 100 people per day versus 4 or 5 people, the back-end analytics and the data, what we call population health management data, are part of the overall plan to kind of help the clinician care team. We're moving towards a holistic approach, healthy living, prevention, diagnosis, treatment, and home care. And all of this underlying capabilities is through health care or connected care and health informatics. And informatics is more the data that's driving it. So yeah, healthcare on demand. Yeah, why not? We have easy access to music, media. We have easy access to banking and money. So our financial system. So why is our healthcare not always on? Okay. So, this is a big question, and we are all, working towards this end goal where we can be continuously monitored. And that also goes to say that the patient or the care recipient is open to having some sort of monitoring, either passive or active, that will allow them to, monitor themselves, and then again provide and share that data with their care team or clinicians. And you're seeing this huge explosion in the fitness world. Many people are using mobile apps to monitor their fitness, their steps, their walking, smartwatches. Many wearables have gotten very easy to use, and the data are collected, and it kind of presents some insights to you to improve your overall healthcare and wellness. So here's part of the transformation. This is for seniors, patients, caregivers, and clinicians alike. So, we're seeing these three major trends: health and wellness, where people actually do want to live well and stay healthy, myself included. Safety, senior safety. This is very critical. One of the biggest fears that I have is my parents having a fall. And as you probably know, falls can be catastrophic with a broken leg or a broken hip, or some other kind of consequence of a fall could cause a person's mobility and health to decline rapidly, almost to the point where they may pass away quicker than you might normally want. And then the connectedness. It's not only about connecting data, but staying in touch with your loved ones. One of the technologies that I'll show you, LifePod Solutions, we have a proactive voice digital care management solution, which basically talks to my parents a couple times a day, checks in on them. And luckily, they're still together, but there are so many people, seniors that are living on their own, who aren't connected, that are socially isolated and have no companion and nobody to check in on them. So, some of these very simple, voice-based or video-based solutions can help with coordinating care and reducing social isolation. So where do we see an explosion of connected care? Well, obviously, the internet is prolificating, either through, broadband deployment in the home, in the resident, in the senior living facilities, or through mobile technologies, right? Smart phones, smart tablets, laptops that may be connected to mobile cellular devices. Well, COVID has accelerated the use of smart technology, and more specifically, the connected home for connected care, reducing social isolation, building communities of friends in senior living facilities, bringing people together so that they're not just stuck in their room all day long for social events. Gathering important data. How are you feeling today, Martha? And collecting this very basic information as to how well they're doing. And obviously, for the payers or the healthcare organizations, accountable care organizations, they're reducing the cost of managing care from afar. And so, this is very important. And then lastly, actionable health and daily routines are leveraged for the clinicians and care team, and also fed back to, the care recipient. So So COVID was a big driver for that. Managing patients at home via digital connected virtual continuums. Well, as I've mentioned, the location is not so important anymore. And it's being, more driven by services and solutions, right? So, with mobility and transportability of a digital connection through a cell phone, for example, a smartphone, we're able to leverage more connected care. And we're also seeing, as a number of our customers for my existing business, accountable care organizations will pay money for promoting and leveraging home and community-based services. And again, this is all enabled by the smart home capability. So how do we connect all of these dots, right? So we have all of these sort of basic smart home devices and technologies, or some that are very use case specific. So one of the things that we do want to emphasize, it's not all about just the devices. Okay, these devices or things are a means to the end. But their true value is in the data they can generate and extract to leverage the service value that IoT can offer to users. And this data is very important to drive solutions, applications, and platforms. And so, this is where we are seeing the Internet of Things drive what we call the analytics of things. So, consider every smart home device does have data that is very useful. Even a smart light bulb, for example, that can be leveraged for these various health tech solutions. Oops, sorry, let me go back here. Okay, so we'll spend a little bit of time on this slide right here. This is kind of a concept slide for the connected home for connected care. And as I mentioned, these things do yield, and analytics require the data that can help promote or yield insights, decisions, interventions, and outcomes. And the goal is to have these insights be actionable if and where enabled. So on the left-hand side, some of the more common smart home technologies, and I would like to say I have a smart home as well. Pretty much all of what I have in my home is connected. Temperatures, HVAC, safety locks, lights, activity, motion detection, audio, video, and voice recognition. So you can see some of these very common things. Where is a smart lock useful for a senior or a patient at home? Well, one of the things I'm worried about is did my parents lock their doors, right? So, maybe every night you might ask the question, or automatically, set the locks, set the night lights through your smart home technologies, increase or decrease the temperature, right? And other things to look at, and we'll talk a little bit more about the voice user interface. A number of people have Amazon Alexa devices or Google Homes. The use of the voice user interface or speech recognition has become very prolific, right? And leveraging video if and where able, smart doorbells, Ring cameras, security cameras, all of these technologies my parents actually have. And so, we can periodically get a glance on, what's happening. If we get an alert after 10 o'clock, why did the camera go off? Or, did mom or dad get up in the middle of the night to use the restroom? And, with some of the presence detectors, right? If we see that my dad has gotten up 5 or 6 times during the night, okay, Well, that's an insight that I'd like to know about. And we might ask them a question the following morning. Hey, are you feeling okay? We noticed you were up and about multiple times last night. So the presence detection or mobility detection can feed perhaps a healthcare use case, right? Maybe they've got a urinary tract infection or something to that degree. Looking down at the bottom left on this slide, well, a couple other things, right? Sleep apnea, respiratory, health watches, telehealth, remote patient monitoring, having the ability to take, glucose measures for diabetes, or congestive heart failure or COPD. All of these sort of medical devices can be in the senior's home, so that they can monitor their health care vital signs and statistics through connected technology. That data is fed back into the electronic medical record, and the analytics and AI in the back end, perhaps within the hospital system, might say, we better check on Martha because her blood pressure has spiked over the last 2 or 3 days, right? So, this is where someone with a chronic disease can be monitored from afar using remote patient monitoring. And that's obviously valuable to the accountable care organizations because they want to prevent a hospital emergency visit or, a medical situation. Personal emergency response service, these are the medical alert pendants that many seniors wear who are either alone and may not have someone to care for them, or they're at high risk of falling. And so, these devices are obviously very important for senior safety. You can measure vital signs, again, as I mentioned, with all of the remote patient monitoring devices. And, one of the biggest issues, this is coming from my wife, is that medication adherence is a very big problem for nurses and clinicians alike. So, making sure your senior or your patient are taking their medication on a daily basis, having a connected medical management device or a digital system that reminds them to take their medication is very important. What's also driving this connectivity is, what is the connection into the home? Is it a DSL line? Is it a cable line? Is it fiber, Fios? Is it cellular broadband? And is there a home hub that can be used as a connectivity hub for some of these remote patient monitoring devices? And there are a number of companies that make them. Looking on the right-hand side, as I mentioned, this is where the analytics of things comes in. We have these health electronic medical record platforms where data are stored, it's orchestrated, it's analyzed, insights are gleaned from, AI-based technology. And, we can look at an entire population at one point in time on a daily basis. And then you can risk profile those who are at high risk and those who are doing just fine, right? And so that data is fed, back to the patient or the senior, the caregiver or the family, the clinicians or the healthcare organizations. Another thing that's, driving all of this is caregiver mobile apps. And these insights that I get from my parents are also very valuable. Notifications, visualization of their data. Hopefully it's good and there's no intervention, and providing all this to the the data decision makers. I'll actually pause for any quick questions if there are any. I'm not sure I can see the chat. Okay. All right. Let me continue then. Hold on, here we go. Okay. A couple other interesting things, and then I'll get into some of the use cases, obviously. And this is one that we can study, but this is some of the new innovation. I'll start on the left-hand side, smart home devices. At the very top, the newer trend is moving from 4G to 5G. Mobile cellular, cellular broadband is now becoming very popular. And perhaps in some cases low cost. You're seeing a lot of different wireless technologies. Those that are most prolific are Wi-Fi and Bluetooth low energy. Voice and speech recognition. My current company, LifePod Solutions, does digital care management, remote patient monitoring using only a voice-based solution, a smart speaker solution. Another, I think, very cool technology is what we call wireless ambient sensing. And there are a number of companies that have developed Wi-Fi ambient sensing. Well, what is this? So this is taking advantage of the Wi-Fi signals in your home or in your living residence, making modifications to those signals, and then determining presence of people moving throughout the dwelling or the solution. And perhaps you have heard of some of these new technologies. Why is this important? Well, this is a wireless solution. It leverages known Wi-Fi technologies with some modification, and it eliminates the needs for passive infrared sensors, video cameras, so on and so forth. So this can be used as a security system. This can be used for fall detection. The sensitivity of ambient sensing is now such that we can determine if mom or dad has fallen. And even with more accuracy in wireless ambient sensing, we can see that respiratory rate or sleep wellness can also be monitored, right? A number of technologies in healthcare are continuous monitoring, not just episodic or periodic. You're starting to see the rise of robotic home assistants. There's a number of companies out there that are having some success in building small little robots that will help mom or dad throughout their day. COVID has driven rapidly the use of telemedicine and televisits. So, patients could not come see their doctors and vice versa. So I'm sure if you all experience this telehealth, televisit boom over the last couple of years, it's generally here to stay. More digital platforms, what we call platform as a service, data as a service, are being built where HIPAA compliant data is stored and utilized through predictive and generative AI, AI machine learning, and what is the result of that are actionable insights. So this is just sort of a kind of a hodgepodge of some of the technologies that are in the home today or will be leveraged by smart homes in the near future. Okay, some technical challenges to address. Well, obviously, there is the cost of broadband, specifically for seniors who live on their own. The affordability of $150 FiOS solution may not be in the cards. So finding lower cost gateways, routers, well, I should actually just say internet service is very important. A couple other challenges, well, all of these devices and technologies don't actually talk to each other in some cases. So, we're still challenged with interworking and interoperability. With IoT devices, billions and billions of connections to billions and billions of devices. If they're not set up or designed properly, then hacking, security breaches, data privacy could be relevant. So we have to be very mindful of that. A couple other things I mentioned already, the voice user interface. Why do I mention this? Well, I think that what we've experienced is that many seniors or older adults who want to age in place, they just want to talk. They don't want to scroll on their smartphone or their smart tablet or smart TV. Many of them don't even have a laptop. But what's the most natural user interface? It's the voice. So we're going to see in the near future more use of speech and voice technologies that proactively or reactively ask how you're doing, how are you feeling, have a little bit of a conversation with you, and collect that data in an automated way versus having the son or the daughter or the clinician or the caregiver make a call every single day. Okay, and this is why this technology, I believe, is important. And then the use of wireless ambient sensing, I think, is a kind of a new smart home technology that you'll probably see for security systems and then healthcare applications. And thinking about all of this, we do need to reduce the costs of allowing this to be leverageable. Okay, let me just check on how I'm doing with time. I'm 30 minutes, so I'll try to go through some of these pretty quickly. Some use cases here, telehealth, remote patient monitoring, smart medication, smart lighting, the voice user interface, ambient sensing, and wearables. So obviously, this is a telehealth solution. I'm sure many of you have experienced this. And, having that broadband connection or a tablet with a wireless connection so that, you could have your televisit on a daily basis with your clinician, or as needed, or in an emergency situation, this has been a highlighted, proven technology that is now here to stay. Internet of Things based medication management. This is some technology that we developed back in when I was at Philips Healthcare. And as I mentioned, medication adherence is a pretty big problem. And as patients and seniors age, they may be taking multiples of medicines per day. And so, having assistance to manage all of those medications, determine if they're adhering. This is a smart home technology that can be leveraged for the benefit of all parties. Connected parent-child monitoring. There are some solutions out there that will help with SIDS and monitoring your newborn or your young children in the home, more specifically when you're not there as well. This is a technology that we developed. So this in particular, you're looking at a wearable, and this is what we call a connected health patch. This takes heart rate. This checks temperature for sepsis. This looks at ECG and a number of other vital signs. And because this is Bluetooth, right? A personal emergency response service button, the cellular, can be used as what we call the mobile gateway. And this is what we call Go Safe Mobile Help button. So this is used in conjunction with a health patch. This one in particular is mobile, so it may not be more specifically used in a smart home, but many people will use this for an on-the-go solution. So if you fall, the button will detect the fall and get help through emergency management service. And then the vital signs are continuously connected as well. Where does all this data go? It goes into perhaps a predictive analytics or AI dashboard. And so this is where the data goes into the cloud. You might have a number of applications, predictive analytics, generative AI insights being gleaned, so you can kind of determine, okay, well, what's happening with fall risk of all of my patients today? What's happening with any other incidences, risk of falling, determine mobility. If their mobility is starting to decline, and that can be measured through an ambient wireless sensor system, then maybe we want to intervene much sooner. This is kind of a far-fetched idea here, but for people who have Alzheimer's or dementia, there's a risk of wandering, right? We kind of put this concept together. I'm also a pilot and I do fly drones, but this particular concept is such that if they're wearing a mobile tracker or a smart watch and they happen to wander outside of their home through their geofence, then what happens is this would trigger an alert for the device that they may be wearing, their smartwatch or their smart PERS device. They're outside of their home geofence. They're wandering down the street. And in this particular case, we start to breadcrumb. We collect their GPS coordinates periodically. And we can also launch a drone that will track and follow their whereabouts. So, this is what we call a geofence wandering solution. I mentioned ambient wireless sensing. I hope you are familiar with some of this. These are a couple of the companies that we have worked with that have developed ambient wireless sensing. And a lot of these technologies are primarily for presence detection, smart home energy management, right? So it determines, like, are there people in this room or that room, or did everybody leave and they're gone? Let's turn the temperature down. Or, hey, they just came into the house, let's turn the temperature up. But more specifically from a healthcare perspective, what's interesting about this is it can do fall detection. And some of these companies are actually working on ambient sensing algorithms using artificial intelligence to determine if somebody has actually had a fall. These are just some of the use cases that you may see. And I'm sure that some of you are very well aware of that this might be the next generation of a smart home security system, right? Because you basically don't have to do anything other than activate the solution. You might need to tune it, but there really aren't any real active sensors, passive infrared that you need to put into the system. One of the companies we work with is Viair. They use this 4-dimensional image radar. This is connected to a number of healthcare solutions. So, if mom or dad get out of bed at 2 o'clock in the morning, why are they wandering around? This in this particular case, these are some of the pods that they have developed for activity and sleep monitoring, and then also fall detection and monitoring. So these are all pretty cool solutions, and basically the ambient sensing technology will tell us if there is a fall, or if somebody's wandering around the house at odd hours of the night, or maybe that there's an intruder, right? But the interesting thing about this is it doesn't have an interface. It may have a mobile app, but people may not be next to their smartphone and get the alerts or notifications. So, what we've done here is we've developed a solution where LifePod, our smart speaker technology, would wake up and say, hey, John, you're wandering around. Is everything okay? And this is the power of this proactive voice user interface that I've been talking about. And if I can just say a few words about my current company, we have developed this smart speaker technology. What's different about LifePod from Alexa or Google Home or some of the other smart speaker technologies is that our patents and our technology are on proactive voice. So what does that mean? Well, throughout the sort of the arc of the day, LifePod would wake up and it would say, good morning, Mary. How did you sleep last night? And, Mary might hear it. It could be in her bedroom or in her living room. And she could say, oh, I had a great night, or I'm feeling well, or I didn't get a good night's sleep. We would have this sort of mini conversation with her. And, if it was a positive experience, then, we would just log that note. But if she said, I don't feel well, or I fell, or I had some issue, then that would drive an alert or notification to the back end to get the caregiver or care team involved, right? So this is an always-on technology. Like I mentioned, we've also linked this with the ambient sensing. And so it becomes the voice user interface. So if a fall is detected, the smart speaker could, proactively say, "Hey, Mary, what happened? You just fell. Are you okay?" And, Mary could respond, "Yes, help, I've fallen and I can't get up." Or, "Oh no, it's false alarm. I dropped something on the floor and I was just picking it up." So that's kind of the beauty of having these kind of combination things. So, this is one of the things that we do for a senior or a patient who's socially isolated. They have nobody there. This is their daily companion. 8 o'clock in the morning, we talk a little bit about, "Hey, did you take your meds? How you feeling?" Reminders to walk the dog. "Hey, would you like to listen to some music? Let's have a healthy meal. Let's water." So on and so forth, through the arc of the day, we can collect these conversations of speech that are related to health, medical, and wellness. And then that all goes into the back end, and these insights are collected. So for example, my parents take their medication 3 times a day. And if I see that they have not taken their medications or they didn't respond, I would get a note saying, "Hey, Alan, you might want to check on your mom because she did not take her medication," right? And that's where having either a conversation or a medication management device comes in handy. So yeah, this is just a couple things that we're able to do with a voice-based user interface for aging in place. Smart home, remote monitoring, fall detection, medication, caregiver engagement, clinical engagement. And this is just one of those use cases. I won't get into this one, but I'll share the slide with you where, hey, something happened, there was a ambient sensor fall, and LifePod wakes up and has a conversation like, "Are you okay?" And then, this is the sequence of events in this use case. And again, part of what we're developing is a very simple, smart speaker technology that has a conversation with your loved one each and every day. And the data are presented to the care team and others for any insights. A couple more minutes and I will be done. You're all also very aware of smartphones and wearables. This is all transforming connected care. Many of you may have smart watches or seniors who may have smart devices where you can collect a number of vital sign or data points on health and wellness. Are you going out for your walk? How many steps have you taken? So these are all big technologies that we're starting to see. Continuous monitoring, like I mentioned, the health patches are here to stay. And more specifically, if you have a patient or a senior who has a heart condition, these patches can be worn and collect all of this data. And not everything is connected to Wi-Fi. We are finding that some homes of seniors are challenged with broadband and Wi-Fi capabilities. So cellular peripherals are now starting to come onto the rise. They're lower cost. They use Cat-M, 4G, 5G technology. Basically, they're collecting data, and all that goes into the back end. So if you have a chronically ill patient or senior, these devices are on the rise. There's not a need for a Bluetooth or a Wi-Fi connection or a smart hub. You can carry and take them with you as needed. So yeah, bringing this all together, we are enabling the transformation of healthcare to a smart, connected, and network patient-centric model. So some last parting thoughts. Yeah, I think you're probably in a very good place to embrace some of these technologies. Consider them for the Internet of Things and smart home development. We have also seen that because our patients and seniors do have connected capabilities in their home, we're able to monitor their health, wellness, remote monitoring, and provide aging in place services. The data are also very, very important. These goes into dashboards, portals, applications that drive insights and actionable outcomes. And overall, we're seeing the reduction in the cost of a number of healthcare situations, emergency medical situations, and or monitoring and insights that could prevent an incident or fall from happening. So I will conclude there. And if we have a few minutes for questions, I'm very happy to take them.
Yes, Alan, we do have a few. Martha, how are we with time? Do we still have time to answer some?
Yes, of course. Let's do another 5 minutes or so of
Okay,
questions.
perfect.
Okay,
Yeah,
cool.
sorry.
So, Alan, so we have a guy here. Let me see, what's his name? Akram. Please forgive me if I'm pronouncing your name incorrectly, but it says, is this connected care system based on specific protocols like KNX? Let me know what is between this system and a wired-based smart system.
So you're asking about protocols, right?
Correct. That's what he wrote here. Yes.
Yeah. Okay. Well, I think, I didn't really get into sort of the deep technical standards, but I mean, we should know that there are protocols being developed to transport like data into the electronic medical records, HL7 and FHIR protocols. Bluetooth standards have evolved, wireless standards have evolved, and I know that there are other smart home technologies and protocols that are being developed as well. So I would generally say that a lot of what I presented here can embrace a number of different protocols. There's nothing more specific that could be leveraged, but we've seen and used them all, right? I will say that that's why the inner working and interoperability may become more important as smart home and connected care becomes more relevant. You may see more standards bodies and protocols that sort of tailor specific to this.
Okay. So we have a couple of more questions before we're done. One more question here. It says, who decides and pays for the technology used in connected homes?
That's a good question. Well, I think there are consumers who will pay and buy these technologies and deploy them as a do-it-yourself sort of consumer-based solution, right? So, somebody who has a mother that lives on their own, they may want to buy a personal emergency response or medical alert service. We're also seeing that healthcare organizations, accountable care organizations, health insurance companies are also paying for these technologies because they can see a specific return on their investment if the technologies are used properly and frequently, right? Specifically with the management of chronic diseases, right? And so that's where remote patient monitoring, medication adherence come into play. So there is, in many cases, the payers who will pay for, a monthly subscription or for the technology.
That's perfect. You answered another question that was here. And one more to go from John D. Where would most elderly consumers obtain the health and other monitoring equipment and services? So basically where they can purchase this or get it from.
Yeah, so that's a very good question. So, we are seeing that the medical alert companies are probably the ones that are starting to embrace this whole concept of an overarching connected home, connected care model. So, for example, I'll give you a name of a company, Medical Guardian, right? So they started out as a personal emergency response service. So they just did, fall pendants and medical alerts. But now they're embracing voice technologies. They're starting to look into remote patient monitoring. So that's where the consolidation of all these different technologies are coming into play. And they offer, what we call an end-to-end managed service and solution. And so what that means is that, they'll either rent or provide the technology, but at the same time, they'll monitor the senior or the patient at home and get the help that that person needs if things are going the wrong way. So that's where I'd say a good starting point is to buy a number of these technology solutions.
Is any of these units, I have a question here, I'm not really understanding it, but it says this hub is connected to nearest hospital. So can it connect to a near hospital, some of these tech?
Yes, in some cases, the service provider or solution provider, these hubs that are specific to, let's say, remote patient monitoring, where you're collecting vital signs, they would have a secure connection from the hub directly, well, over the internet, into the electronic medical record or into the hospital's EMR or health cloud, so to speak, into their platform. And so, yes, a lot of these cellular devices, they would go securely right into the back end of a hospital or a clinical practice back end. So there are a number of different ways where the data are collected. Much like the Apple Watch, for example, that data gets stored in the cloud provided by Apple, but the data are shareable through permission to your primary care physician, for example. So there are a number of different ways the data are transferred.
So I have one final question with this one. We'll pass it on to Martha. But what if a notification alarm cannot reach a caregiver? Who is responsible?
Yeah, well, that is a very good question. Ultimately, the service provider and solution provider are mainly responsible for that. But yes, we are seeing that from a broadband connection perspective, you're seeing some cellular providers providing a more robust connection that's used for emergency response services, et cetera. So we are seeing that the broadband providers may also be responsible in addition to the solution provider. Now, the other kind of key thing is that there are heartbeats between the solution backend all the way to the device. So, every 5 minutes, we would say, oh, the connection is good. The connection is good. And so then you're looking at the end-to-end service, and that's the responsibility of the service provider.
So it's constantly testing out to see if there is availability to send the message out. Perfect.
Exactly. Especially with emergency response service, you want a heartbeat continuously every minute or every 5 minutes to make sure that the network has not gone down, right? So that's a good question.
I think with this, we're done. There is another more direct question to you that's on the chat that you could read on your own time if you want. But Alan, thank you so much for joining us. This was actually really, really informative for me that I'm in that smart building, smart home world. It was perfect. I think the questions and the answers were also perfect. Thank you so much. I'll pass this on to Martha now.
You're welcome.
Thank you so much, Alan. Thank you, Josh. Appreciate it. Just want to take a quick moment just to go over some of our programs before we part for the day regarding our Smart Homes and Buildings podcast. Industry leaders, innovators share practical insights on technologies shaping smarter, safer living spaces. If you're interested in being a guest or a host on the episode, please let me know. These are very flexible episodes in the sense that you can be the host, you could be the guest, you could bring anyone on if you'd like. We could search for a host or guest for you. You would just let us know what the topic is. But please let us know if it's something that you would be interested in. We'd love to meet with you, quick call just to give you the rundown of how it all works. And we guide you every step of the way. We work with you. We are basically the middleman between you and anyone else that is involved on these podcasts. And of course, it's an opportunity for your organization to showcase itself and knowledge and be a leader in shaping some of what we do in this space. Our most recent episode, Roy Spencer explains how smart tech like Basement Defender can prevent costly water damage. And also Robert Soler shares how circadian lighting supports better sleep, health, and performance. You can view or listen to recently recorded episodes on Spotify or Apple Podcasts. And the link to that is on ashb.com/podcast. And I will pass it off to Ken to go over our white paper program and some of our other programs here.
Thank you, Marta. I'd like to talk about two initiatives that ASHB has to provide timely information to you about developments in our industries of home and building systems. First of all, at the Smart Home Committee, we have the opportunity for you to develop white papers. These can be introduction to a new field. They can cover the marketing aspects, the technology aspects. We've published many white papers that are available at the ASHB library. The key here is that the idea for the white paper comes from you, the Smart Home Council member. You propose it to Marta and me, and we will set up a review committee made up of volunteers from ASHB to help you develop your white paper. And so you would take the initiative and proposing a topic and actually doing the writing, and we would provide a committee that would help guide you and review your work to make sure it's relevant to our mission and to give you our feedback as to its utility and readability. Our typical white papers are around 10 pages or so. If you've got a lot to say, you can divide it up into a series of white papers where you might have an intro white paper, a technology white paper, a market development white paper. We also search the industry for papers published outside of ASHB, and we've assembled a research library with thousands of relevant articles typically from the trade press, sometimes from journal articles. We have a committee at ASHB called the Publication Review Committee that consists of folks from ASHB and friends of ASHB who volunteer to review these papers. And as a thank you, ASHB provides $25 in credit to ASHB services and $25 in cash as a thank you. Ideally, we'd like to have every ASHB member review 5 papers a year. Let's say that's aspirational. We do have a number of members on the of ASHB who do volunteer and do the work. That's why we've been able to assemble quite an impressive library. The library is limited to ASHB members for the first 2 or 3 years. After that, the papers are available to the public. Marta, what's our paper total now in the library?
We are close to 1,000, Ken.
Good.
Yeah.
So,
and just a quick note, Ken, for ASHB members on the call today, if you would like to access this library, you would just go to our website here under Research and Information, Members Library, and then access the ASHB member library. You will be asked for a login. Please let us know if you are unable to log in, and we'll provide you with a username and passcode for you to access those reports and white papers.
ASHB also offers you the opportunity to publish original papers on your own outside of the committee work. This is through the ASHB Journal. The ASHB Journal has been in progress almost as long as ASHB and its predecessor, CABA, have been around. So we're talking roughly 30, almost 35 years that the ASHB Journal and its predecessor, iHomes and Buildings, and the CABA Journal have been published. This is a very good outlet for your ideas. It's a widely recognized and widely read journal. Proud to say I've been contributing to it since about 1991 or 1992. Been publishing an average of 3 or 4 papers a year. So I personally endorse the ASHB journal and encourage you to submit papers. Mata is very efficient at reviewing the papers, getting them posted onto the web page so that they're readable. You will have an opportunity to proofread your article before it goes live. And then it's available to the world through the ASHB Journal, which is open to the public. So at this point, let me ask if anyone has any questions on the white papers, the research library, or the ASHB Journal. And also ask if anyone has any new business they'd like to raise at this time. New business might include your ideas for a keynote, for white papers, for research projects for ASHB to undertake, and items we should put on the agenda for our quarterly meetings. Okay, Mata, you're on to the next agenda item about announcements.
Thanks so much, Ken. This will be our last agenda item for today. Just a quick review of some of the events that are coming up in the residential space. We have the Canada Light Expo here in, Toronto, November 12th to 13th. Future Video Business of Streaming, and that is from Parks Associates. That is taking place November 18th to 20th in Marina Del Rey, California. And of course, we have CES taking place January 6th to the 9th in Las Vegas. We will be attending. We have a booth there as well. So please stop by and say hi. And then also we will be hosting our board meeting, the first of 3, actually 4, this year, or in 2026, I should say. And lastly, we have IoT World Expo that's taking place in Fort Lauderdale, February 10th to the 12th. And that is all.
Okay, thank you very much, Mata. So we are about to adjourn. A last opportunity for anyone to make comments. We do meet quarterly. We will have a meeting on a date to be announced in February next year. So I want to thank you all for joining us. And I want to thank Mata for making all the arrangements for this very productive meeting, and thank our featured speaker.
Thank you so much, Ken.
You're very welcome, and thank you all for coming, and we are now adjourned.
Thank you.
Bye, everyone.
Thank you.